Welcome to the hordes of members of the public who've managed to make their way to the annual general meeting. I'm sure there'll be quite a few people who will either be tuning in live as we speak or will watch video recordings of this meeting later. I can't help but comment that Alison Smith, who's been organising us for days for this meeting, she's about the only person who's not managed to find a way to the meeting just yet, but I'm sure she'll be here very soon.
I think she's still organising.
She's still organising. What I would like to do is introduce Claire Corcombe, who you might have seen before, but Claire has been officially appointed our board secretary. So congratulations to Claire. Claire will be joining these meetings, board meetings, etc., on a routine basis from now on. I've had apologies from Trevor Macmillan and Roger Dunshay, and a few welcomes I'd like to, a few personnel changes I'd like to just comment upon as part of my introductory remarks. Since we last met in the AGM about a year ago, we've said farewell to a number of close colleagues: Alison Bussey, Nick White, Gareth Robinson, Louise Barnett, and Julian Povey in one sense, but we have the reincarnation of Julian Povey in another sense. Julian is no longer one of the GP partner board members. He's been replaced, and welcome Deborah Shepherd, who will be known to so many people because of the work that you did, Deborah, with the CCGs and lots of other things as well. It's great to see you around this table again. Other welcomes, I'd like to just welcome Vanessa. Where's Vanessa? It feels like you've been around for an age, but this is your first AGM, and we're delighted that you're formally appointed as our Chief Nurse. Welcome also to Lorna Clarkson, our new Chief Medical Officer. Again, Lorna feels like she's been working with us for a considerable period of time, but it's officially only a couple of weeks, I think, isn't it?
Yes, it
and it's your debut in the board meeting. It's great to see you. Also to Ian Bett. If you look at the mugshots later for the board, there's a quiz question for you. Spot Ian Bett. I'm not going to say any more than that at this stage. Welcome also to Joe Williams, who I'm not quite sure what your official title is, other than I know you're the CEO of SAF. But you are really welcome, and we very much look forward to working with you. And you've been with us for what, 2 weeks now?
This is week 2.
Week 2. Now, I've probably not remembered a number of people and offered fond farewells and welcomes, for which I apologise. But one thing I just wanted to say is I see sitting around this table a very strong, competent, experienced leadership team. And I'm really pleased at the way in which it's been constructed, particularly over the last few months or so. And I think it augurs well for the future. So welcome everybody to Shropshire, Telford and Wrekin, and to this meeting. Now, the AGM is a statutory requirement. I hope some of you've managed to visit the marketplace upstairs. Some really good opportunities to see staff showing off the wares of their departments and functions. Fascinating. I've learned one or two things about my own organisation spending time up there, which is very, very good. Now, the agenda itself is fairly straightforward. Declarations of interest. I'm not aware of any new declarations of interest. The minutes of the previous meeting, I defy anybody to remember their accuracy, given that they're a year old, but you are entitled to comment upon them should you wish. I don't have any matters arising therefrom. And if you're happy for us to move on, we will move into the first substantial item, I suppose, which is the ICB achievements over the last 12 months. Reasons to celebrate. Now, our colleagues in the corner were saying, who's going to change the slides? And I said, don't worry, Alison Smith will be here in time and she'll keep us in order, but she's not here at all. Can somebody down there just help us move the slides? Oh, Dr. Povey, you're offering.
Yes. Next slide, please.
Next slide, please, Dr. Povey. Thank you for volunteering, Julie. Simon, over to you.
Thank you, Chair. We're just, I think we're just sorting out some Wi-Fi issues in terms of people connecting and making sure they can access papers. So, look, I'm not going to spend a big chunk of time having a conversation today. There's a couple of slides that we'll go through. Of course, the challenge in AGM in September is that we're looking back on 23-24, and so much has happened then in 24-25, given we're 6 months through, that it can feel as though you're talking about things that have already moved on and are in a very different place than they were in 23-24. However, there are some bits that I think it's just important at an annual general meeting to make sure that we land and are clear on and reinforce. The next slide, please. I think some of this to colleagues in the room is absolutely stating the obvious. But I think there's an interesting conversation happening presently now nationally that resonates with the responsibility in terms of planning and buying health and care services for the residents of Shropshire, Telford and Wrekin. And that's the language of commissioning coming back into a conversation. But the language of commissioning coming back in a conversation in terms of actually let's make sure that we're doing this in terms of outcomes for the residents that we've got responsibility for, and we don't fall back into a situation where we're looking to count things and manage a contract on what we count rather than actually what difference are we making to the residents and what difference are we making in supporting our clinical and professional colleagues to be the best they can be across the work that we ask them to deliver in Shropshire, Telford and Wrekin. So I think what you'll hear me talk about is the management of change that the ICB has gone through, which was aimed at making sure that we're fit for purpose in terms of our role in the system. So we recognise, in terms of looking back in 23-24, there are elements that are not as good as we would want them to be, and we've got challenges, and we need to be honest about that, and let's be authentic about that. But equally, let's ensure that that doesn't mask the amount of good work that takes place every single day in terms of the interactions that residents and health and care professionals have and the work that takes place and the positive difference that's made to people's lives in that space. Can we do better? Absolutely. Do we need to do better? Absolutely. But is there good work happening as well? And is it important that we recognise and say thank you to colleagues for the work that gets delivered? Absolutely as well. So one of my points this afternoon, Chair, is to thank every single member of the health and care system across Shropshire, Telford and Wrekin for the work that they deliver, for the care that's provided, for the support and the compassion that's offered, often in difficult and challenging circumstances, but let's just recognise whether that be any of our support functions, whether that be our frontline colleagues, whether that be our senior management colleagues, colleagues sitting around this table, our non-execs, voluntary and community sector. My intention here is not to miss somebody and offend anyone, and there's a risk in that, but to say thank you for that, and then as the Chief Exec of the Integrated Care Board, is to thank my own team for the work that they delivered in 23-24, and would just want to make sure that that's on record. Thank you for that. Next slide, please. And next slide again, please. Neil's already touched on this actually. If you look at this photograph now looking forward, compared with where we were 12 months ago, there's been quite a change on a number of faces on here. And as Neil said, want to recognise and thank colleagues that were working on behalf of the system in 23-24. But I think that actually we've also got the opportunity to look forward at this AGM, given we're 6 months through the year. And I think that having a board that's fully populated, and I don't mean that in a patronising way at all, and then populated with the individuals and the calibre that we've got here as the senior leadership team to take forward this system, then actually we should have something, we should feel a great sense of responsibility in terms of that leadership, but also the positivity and the hope and the potential that exists sitting around this table to lead the health and care system to deliver that improvement that's required in terms of the population that we serve. And I think it's really important that we just do not ever forget that we're here as servants of the population and the residents of Shropshire, Telford and Wrekin, and that's the core purpose in terms of why we sit around this table and why we commit to the work that we do. Next slide, please. There is nothing that's going to change the world on this slide that people are going to look at and say, oh, I hadn't considered that, I hadn't thought of that. And equally, you could easily take this from the recent Darcy review and say, actually what was written in that review commissioned by the government, we see playing out in our system. Whether that be the challenges in terms of waiting times, whether that be the challenges around urgent and emergency care, whether it be about access and demand to primary care and to mental health and children's services, the impacts of industrial action, cost of living, the ageing population, the long-term conditions, everything that is in the Darcy review published 2 weeks ago, we see in Shropshire, Telford and Wrekin. So nothing more to be said on this other than we know what the challenges are. Our responsibility is to say how are we tackling those and how are we making that positive difference. Next slide, please. So we do need to do that look forward bit as well though. I talked about the management of change in terms of the integrated care board and putting the new staffing structure in place. That's 95–96% completed now, and that's been a big change in terms of for colleagues working in the integrated care board, but we're in a better place going forwards in terms of the structure to be able to meet the ask of working with system partners, that system convener role, that facilitator role, that partner role. I think we're better placed now, and with the refreshed exec team to provide that leadership with the senior leadership team, I think we've got a great opportunity to work in partnership with our providers, with our other partners, with our 2 local authorities and with the voluntary and community sector to really think about what this looks like going forwards and how we bring about the change in the system. We are sitting in a room that is part of the single office location that's taken place. So from an ICB perspective, we have moved out of 2 office bases, consolidated here, working with a new agile working policy, and there is just a different feel about both the building, for those of you that previously went to Halesfield, and you hear that from staff, and we're grateful to our colleagues in Telford and Wrekin Council for their work in supporting and facilitating that move and the use of the office space. I say that positively because I'm sure there'll be a rent review coming up soon, and I want to make sure there's a
He shook his head.
He did shake his head, yeah. Was it a nod though, Chair?
No.
No. Okay. Look, in terms of the looking back bit, we did make a significant step forward in terms of tackling and dealing with some of the really long waits in 23-24. We'll hear as we get into the board meeting later, we've got some challenges in terms of where we are now, but still the position is improved compared with where it was in 23-24. And I'm confident and clear in speaking to colleagues, the focus and the unremitting effort to continue to drive improvements will take that forward. Significant progress in terms of the Community Diagnostic Centre, the work that's been done around the virtual ward, the rehab wards that have been opened and been delivered. So the work in a number of these areas absolutely provides us with some of those building blocks to be able to take this forward. In the Chief Exec's meeting this morning, we heard the progress that's been made on children and young people's mental health waiting times and on the talking therapies waiting times is really significant, positively significant. And yet we're missing the opportunity at times to really promote quite the change that's coming about and the difference that's been made. And so, you know, we've got a responsibility to make that one more visible, but actually to make sure that we're hearing from residents, we're hearing from children and young people about the difference that it's making, because that's the most, this is not about a comms exercise, This is about the difference it's making to the residents across Shropshire, Telford and Wrekin, and Chief Exec colleagues heard that this morning with some really inspirational presentation in terms of some of the areas that have changed and some of the difference that have been brought about in that area. Facilities and community hubs. So for anybody that's had the opportunity to go and look at the work that's taking place in Highley, it's a really positive environment and a really positive approach where you can demonstrate the way that a community can work together and partners can work together to really think about that the hub development of basing in a local community and meeting the needs of the local community, working in partnership. And we are absolutely clear the focus on continuing to develop and work with primary care, and I use primary care in its broadest sense, general practice, dental, optometry, community pharmacy, is absolutely fundamental to our look forward in terms of how we want to work in that space. And there are a number of services that we could have talked about, whether that be the really positive work that's happened around the community musculoskeletal service, whether that be some of the work that's taken place, again, in terms of the partnership around mental health, and some of that community-based services, some of the improvements that have taken place within our local acute trust, the partnership with our local authorities in terms of some of those areas where we can demonstrate to local people the positive step forwards that have been made is absolutely the right building blocks for us to say how do we take that forward, not just in 24-25, but in terms of 25-26. But before I pass over to Claire, I'll just finish with the reinforcement of saying thank you. Thank you to colleagues sitting around this table for your support, for your commitment and for your effort. The honesty of recognising we've got a lot still to do, but the absolute optimism and confidence that it's with the leadership sitting around this table and with our partners that we can make that positive difference for Shropshire, Telford and Wrekin. Thank you, Chair.
Thanks very much, Simon. I'm going to ask for questions at the very end of the presentations, if I may. And I also just want to draw attention to the fact that if you're wondering where's the annual report, which often appears in AGMs, you might remember we looked at the annual report at a board meeting a little while ago. It must have been the last board meeting. If people are sufficiently interested in that, then it's available on the website, and everything that Simon has said will be in there, plus a lot more if you wish to read about it. So let's move on to the next item and the next slide, please. Thank you.
Thank you very much. Next slide, please, Julian. Thank you. So after all that brilliant kind of reflections on the last 12 months, I get to talk about the not quite so exciting statutory bits. So as an ICB, we're a statutory entity, so we have duties that we have to comply with, and particularly around finance and our use of resources. You know, we have to make sure that we can demonstrate value for money in what we spend, because we're custodians of the public purse. What we've reflected on this slide is purely the sort of standard statements that have come through from our external audits. So first of all, on the left hand side, we have had confirmation that our financial statements are sound, and you'll see here give a true and fair view and are properly prepared. All very formal words, but ultimately as a board we signed off our accounts back in June time, and those were supported by our external audit. Our auditors also do an annual value for money assessment, and they present their findings around 3 key areas, which is the same for every ICB across country: financial sustainability, governance, and then improving economy, efficiency and effectiveness. It comes with no surprise that we have amber ratings for the second 2 of those items. Recognition that there are no significant weaknesses, but obviously there's more to be done. I like the fact there's more to be done. It gives us plenty of room to seek to improve further, which I think is a really good thing for us. We know and we recognise the struggles that we have with financial sustainability, and that's reflected in the red categorisation for that particular area. But you'll see a thread through our board reports and the themes that we have through our subcommittees, where we talk about the efforts that we're making to address that and make sure that we can put ourselves onto a sound footing. Next slide, please. So what I wanted to do was just put into context the money side of things for our ICB. So we support a population of nearly 534,000 people, and to do that we're given around £1.2 billion for the year. Sounds a lot of money, and it almost becomes unreal when you talk about numbers at that scale, but that's about just over £2,000 per person. So when you look at the breadth of services that we have to commission on behalf of our population, we have to be really frugal and make sure that we're getting the best value that we can, because it doesn't go very far. We maintain a low running cost position, so only around 1% of our total expenditure is spent on running the business. We put as much of our effort and energy and our money towards patient care. Unfortunately, linked to the financial sustainability point, we have delivered again an in-year deficit, and for the ICB that was £16.2 million, but we're very clear about what drove that deficit, and it's listed on the slide. We know we had significant costs through the independent sector, and particularly ophthalmology, driven through the patient choice agenda. We talked about that at board through the year, and certainly at finance committee. We had expenditure to support discharge, which was in excess of our plans at the time. And also linked to that, we've had sort of package price increases in individual commissioning. So as we exit COVID, market pressures have been quite pronounced in certain areas. CHC, continuing healthcare and individual commissioning being one. Prescribing prices, the fourth bullet on there, was another area where we're having to absorb inflationary pressures beyond those that we were funded for. What I did want to highlight though was that in our financial position, and in spite of delivering that deficit, we had a really challenging efficiency programme that we set ourselves to deliver, and we delivered £26.8 million worth of savings in the year, of which over 3/4 was recurrent, so it's got a lasting impact in our position. I think that's a really positive statement and indicative of the hard work that the team's put in to really drive in that value for money agenda. If we could go on to the next slide, we've put our numbers into a pie chart. Those that have been to previous AGMs will have seen this in previous years as well. Very quickly, what you can see is that 50% of our spend at the moment is targeted towards hospital services, and then we've got various sections of the pie then for community services, primary care, prescribing, mental health, and all the other areas that we commission. So as I say, that £1.2 billion has to cover a heck of a lot of expenditure, but at the moment, and certainly for last year, about half of that went into acute services. Now Julian, this is where I'm going to test you. Can I go forward 2 slides and then come back one in a moment? just to really see how we're going. Look at that, professional. We'll see what happens in a minute. What I wanted to do was also give some context. So where does the money go? So hospitals or community or mental health. Let's make that a little bit more real as well. So I'm not about to tell you about every single thing we've spent our money on, but actually, when you look at some of the key areas, the patient-facing areas, I really do think that the services that we commission, our provider colleagues and others, should be commended for the work that we do. So very briefly, and I'll pick up some highlights from this slide, but through 23-24, we saw 135,000 A&E attendances for our population. Just over 4,700, put the and 4 in, babies were born. 41, nearly 42,000 ambulance journeys, and then we get into some really big numbers. So we issued just over 10 million items on prescription through the year, and our GPs saw a staggering number of patients through the year as well. As I say, sometimes if I talk about billions and millions of pounds, it starts to become unreal and you can't really see what that looks and feels like, but certainly when you put it into the context of the numbers on the slide, I think you can see the amount of activity, particularly for healthcare, that's going on in our system every day. Right, Julian, backwards. Fabulous, thank you. And then the look forward piece. So We have a deficit plan as an ICB of £50.3 million. Some of the financial issues that we have are structural. We're not going to fix them overnight, and we've got to do it carefully with an eye on not just our performance but on the quality and safety of services as well. So that £50 million is set in the context of a planned deficit for the system of 89.9 million, and those are the numbers that people will recognise for 24-25. We're doing a lot of work at the moment to refresh our finance strategy and start to look at what our medium-term finance plan looks like. And certainly we had a conversation with chief execs this morning. We've got conversations that are active now in our finance committees about what that medium to long-term finance trajectory looks like. That's only as good as the work that we do operationally, clinically, and with our workforce colleagues to really test the impact of those numbers. And just a reflection very briefly, we are at level 4 of the National Oversight Framework. We talk a lot about NOF4 as a system. We're part of the Recovery Support Programme. We have an integrated service improvement plan, of which it's no surprise our financial strategy and recovery is a really fundamental element. All of the things that I've just talked about in terms of our ambition to get back to break even and that medium-term financial recovery plan will stand us in good stead, not just in terms of financing the services that we're commissioning for our population, but also to provide the evidence through that programme that we can reduce down those tiers of national oversight and make sure that we're evidencing the really good work that we're doing actually as a system. Pause there. Thank you.
Brilliant. Thank you very much indeed, Claire, for that financial overview. Let me just take the opportunity to ask if anybody has any questions, any comments they'd like to make before I say a few final words but in conclusion. Any? No? Okay. So I just want to repeat Simon and Claire's thanks to you all and to very many people who aren't in this room for the hard work, the endeavour, the commitment, the imagination as well that's gone into the delivery of health and care within our system during the last 12 months. It's been difficult. There's no doubt about that. It has been difficult. But I really do feel, with the team that's been constructed around us that we talked about earlier, that there's a cause for optimism, and the strength of this system, in my view, has always been in terms of the relationships between the individuals and the organisations. As you know, I move on to fresh climbs in the near future, and I would just urge you all, whatever happens, to hang on to that strength of partnership, because that is a really important ingredient for future success. And if that's lost, then I would fear for services within the system, but I've no reason to believe that it will be. So I would certainly apply that exhortation, if I may. The other thing to bear in mind, of course, is that we've got a new government, and Simon mentioned the things that we need to look forward to and plan for, and we'll talk more about this in our board meeting in public shortly. But remember that the Secretary of State's 4 big ticket items that he keeps talking about kind of vary slightly around the edges, but the core of them, it seems to me, is prevention, hospital to community, moving to digital, and something about primary care, which seems to be slightly more vague than some of the other commitments, but it's there. And we need to be making sure that our plans for the future and the work that we do builds around those particular areas. I'm in despair, dismayed that social care doesn't get a feature, a mention by the new government to speak of yet. And frankly, I think we'd all agree that until that's fixed in one way, shape or form, we're all going to find it difficult to deliver the kind of ambitions that we have for our system. But still, there's a lot of progress that we can make. Final comment from me in this territory is we hear a lot about the NHS is broken. I don't believe it's broken at all. Unquestionably, there are lots of challenges. But the notion that the NHS is broken just does not stack up against the kind of things we've heard about this afternoon, although we know we can do better. And I think we ought to be constantly trying to find ways of offering a vision of hope and of optimism and ambition, rather than wallowing in the kind of sense of that the NHS is broken. Now, that's my personal view. I suspect many of you would concur with that, but I feel very, very strongly about that. Finally, I just want to give a personal thanks to Simon, Claire and the executives and the board for all of your work during the last year. It's been sterling and at times beyond the call of duty in terms of the work that has been done. And I think it's something for my successor and others to ponder. How do we get more public interest in our annual general meetings? I made a flippant comment at the beginning, but it really would be good to find a way of encouraging more members of the public to join us in these AGMs and participating in discussions about our successes and the kind of ideas that we have for the future. But that's for another day. That's for others to ponder. And on that note, unless there's any other business, I declare the meeting closed. We have a 12-minute respite before we move into the ICB board in public. Thank you all very much indeed.